Ethical issues in residents with Alzheimer's disease, ethical conflicts, justice, kindness, beneficence, end-of-life issues, mandatory reporting, autonomy. Autonomy is Greek for self-rule, and it's basically another word for liberty. If you have autonomy, you are able to make your own choices and go your own direction. Autonomy is all about thinking for yourself and acting on your own desires while living in a free society whose laws give you the liberty to make your own decision. Autonomy is considered a form of individualism. Most proponents of autonomy argue for individual freedom. However, some forms of autonomy are more collective than others. Individual autonomy begins as it belongs to each human person. Individuals should make their own choices about how to live their lives and should be independent from the group. In a modern world, this tends to be more popular. Autonomy is the right to self-determination. They have the right to make choices and decisions about certain aspects of their care. They have the right to determine what behaviors or actions require intervention. For example, sexuality, harm to self or others. Autonomy examples. What would you do when your residents refuse to eat? Can you make them eat? Is it safe for them not to eat? Do they still have control over whether they eat or not? Or can you overrule them? What happens when they refuse to bathe? What happens when they refuse medication? They disrobe in public. They act sexually inappropriate, or they disagree with you. Are these examples of when you should take over and make decisions for them? Or are they still able to make those decisions? Kindness and beneficence. Should you tell your loved one a lie? Should you use validation therapy? How does palliative care and end-of-life issues apply? Are you taking all measures required? Those who work in dementia care settings face difficult ethical decisions every day. They must balance a person's day-to-day autonomy and dignity against a person's need for safety. They must also balance their own needs with those of the person with dementia. Often there is no single right answer, and stressful strategies can change as the dementia progresses. Caregivers must balance the needs of multiple residents. They must consider issues related to confidentiality, the potential for elder abuse, and the benefits and risk of medication and procedures. When an individual is no longer able to express his or herself, a designated decision maker must step in and make difficult decisions. The decision maker must put aside needs and desires of the self and carry out what is believed the person with dementia would do if able. Autonomy, beneficence, and justice are ethical principles used in healthcare settings. Autonomy is an American value. We have great respect for individual rights and equate freedom with autonomy. Our system of law supports autonomy and upholds the rights of individuals to make decisions about their own health care. Respect for autonomy requires that patients be told the truth about their condition and informed about the risks and benefits of treatment. Under the law, patients are permitted to refuse treatment, even if the best and most reliable information indicates the treatment would be beneficial, unless their action may have a negative impact on the well-being of another individual. These conflicts set the stage for ethical dilemmas. Beneficence is the act of being kind. The beneficent practitioner provides care that is the best interest of the patient. The actions of the healthcare provider are designed to bring about a positive good. Beneficence raises the question of subjective and objective determinations of benefit versus harm. A beneficent decision can only be objective if the same decision would be made regardless of who was making it. Justice speaks to equity and fairness in treatment. It may be seen as having two types, distributive and comparative. Distributive justice addresses the degree to which healthcare services are distributed equally throughout society. Comparative justice determines how healthcare is delivered at the individual level. In a society where equal access to healthcare does not exist, there is a continuing concern about the distribution of resources, particularly as the population ages. Making decisions is part of everyday living. For the most part, these decisions are an automatic and unconscious process. Ethical issues. Beneficence is the action that is done for the benefit of others. Medical professionals are supposed to act in the best interest of patients even when they are not competent enough to make their own decisions. Case studies. What is the right thing to do when? The resident demands to know their diagnosis. The resident wants to go home to a deceased person. The resident mistakes you for a deceased person. Justice. Personal values and justice. The need for advance directives. You need to respect their wishes even if they can't talk anymore. Autonomy versus safety. The professional caregiver has the duty to put safety first. Ethical issues. Justice. The moral obligation to act fairly and to respect people's rights. The patients have the right to be treated fairly, equally, and have the rights respected. Justice case studies. As the end nears, the AD person is bedbound, has major organ failure, and is continent. What is the right thing to do? Is it okay to withhold nutrition? Who decides for the person who can't decide for themselves? Do you continue to treat infections? Should you keep them hydrated? End of life decisions. When is it appropriate to discontinue medications? When is it appropriate to let go? Planning ahead provides a framework for decision making at the end. What were the last wishes? What is comforting to the patient? Knowing the resident's last wishes can relieve suffering for the caregiver and resident. Abuse. Resident abuse, verbal or sexual, financial or physical. You must report abuse appropriately. Abuse can happen to anyone, no matter the person's age, sex, race, religion, or ethnic or cultural background. Each year, hundreds of thousands of adults over the age of 60 are abused, neglected, or financially exploited. This is called elder abuse. Abuse can happen in many places, including the older person's home, family member's house, an assisted living facility, or nursing home. There are many types of abuse. Physical abuse happens when someone causes bodily harm by hitting, pushing, or slapping. Emotional abuse, sometimes called psychological abuse, can include a caregiver saying hurtful words, yelling, threatening, or repeatedly ignoring the older person. Keeping that person from seeing close friends and relatives is another form of emotional abuse. Neglect occurs when caregivers do not try to respond to the older person's needs. Abandonment is leaving a senior alone without planning for his or her care. Sexual abuse involves a caregiver forcing an older adult to watch or be part of sexual acts. Financial abuse happens when money or belongings are stolen. It can include forging checks, taking someone else's retirement and Social Security benefits, or using another person's credit cards or bank accounts. It also includes changing names on a will, bank account, life insurance policy, or title to a house without permission from the older person. Financial abuse is becoming a widespread and hard to detect issue. Even someone you've never met can steal your financial information using a telephone or email. Be careful sharing any of your financial information over the phone or online. Healthcare fraud can be committed by doctors, hospital, and other healthcare workers. It includes overcharging or billing twice or falsifying documents and claims. Most victims of abuse are women, but some are men. Likely targets are older people. You may see signs of abuse or neglect when you visit an older person at an elder care facility. You may notice that the person has trouble sleeping, seems depressed or confused, loses weight for no reason, displays sign of trauma like rocking back and forth, acts agitated or violent, becomes withdrawn, stops taking part in activities they used to enjoy, has unexplained bruises, burns, or scars, looks messy with unwashed hair or dirty clothes, develops bed sores or preventable conditions. Elder abuse will not stop on its own. Someone else needs to step in and help. It's your job to report it. Financial abuse, taking money that belongs to a resident. Sexual abuse, a non-consensual sexual contact of any kind. Physical abuse, use of any physical force that may result in bodily injury, physical pain, or impairment. Verbal abuse, the infliction of anguish or pain through the use of verbal or nonverbal acts. How do you report abuse? 1-800-96-ABUSE is the abuse hotline. People with dementia are most vulnerable to abuse. The case. An 86-year-old woman with Alzheimer's disease was involuntarily discharged from a nursing home for wandering, agitation, and fighting. These undesirable behaviors persisted despite medication management by consulting psychiatrists throughout her 6-month stay. Facility staff reported that the resident wandered into others' rooms and slept in their beds. She fought with other residents over a baby doll. On more than one occasion, she struck staff when they awoke her or when they attempted to remove her undergarments to provide incontinence care. Discussion. The case illustrates common, undesirable behaviors in patients with Alzheimer's disease, conflict between the patient, other residents, and staff, and the use of antipsychotic and other psychotropic drugs to control behavior and prevent conflict without success. There are many ethical and philosophical issues surrounding the use of medications to control behavior, particularly in patients who are unable to give informed consent. She transferred to a new facility. They took her off all medications that were used to control her behaviors. The new staff responded to periodic episodes of agitation with reassurance, conversation, organized activities, distraction, and walking. At mealtime, she believed that she was the hostess at a large party and would not eat until others had eaten. Facility staff went along with her belief and offered her food at other times, along with frequent snacks, in addition to meals in the dining room. In this case, the question should have been, do antipsychotropic drugs control behavior in dementia? Do they cause problems? Does the benefit, if any, outweigh the risks? Level 1 post-test. Some forms of memory loss is reversible. It is best to correct a person with Alzheimer's. ADRD presents itself the same way for all individuals. B12 injections can prevent dementia. Residents with AD do not like consistent schedules. Alzheimer's persons never get abused. You should treat AD residents with respect and dignity.